Oh, okay.
So I'm a surgeon. I specialize in cosmetic surgery currently, but my practice specializes in weight loss surgery, general surgery, plastic surgery as well.
Ah,
So when we talk about weight, that's usually the topic of our conversations. It's not the number. We talk about overall health of the person, and it all comes together. It doesn't matter if you're looking at it from cosmetic surgery standpoint, bariatric general surgery standpoint, or just people in general. We talk about how can we improve somebody's health, and kind of that's our specialty.
awesome, awesome. I'm a little familiar with bariatrics. Let me ask a question. The how is it now? You know, with your patient selections in that particular field now.
How is the patient selection?
Yeah, how's the selection process now with people going that are, how are they being approved for surgery now?
Well, there are a couple of different ways, and it depends how it happens. Unfortunately, bariatric surgery does not get covered by insurance as a standard. Like, for example, not the same way as your gallbladder surgery.
Right.
So, for those who do have insurance and do have coverage, they usually have to go through about 6 to 12 months process with their insurance, seeing doctors every month, seeing nutritionists, and kind of like drawn out long process um, for approval to show that, yes, there's truly a certain BMI number and some health conditions associated with it. If somebody does not have insurance and they just willing to pay for surgery out of pocket, which a lot of people end up doing because there's still a lot of people without coverage and without insurance, then they can come in, get evaluated by the doctor, like for any other surgery, get a couple weeks of preparation, certain evaluations, and get the surgery done and pay out of pocket.
Oh wow. The now yeah, it is a long process for when it's covered by insurance. Which procedures are you specializing in now?
So for weight loss surgery, for bariatric surgery, we do everything. I have 5 bariatric surgeons in my practice in 2
Okay.
states. And so we do gastric sleeve, that's kind of gold standard, gastric bypass, duodenal switch, and there's a lot of those non-invasive procedures where we can do gastric sleeve without incisions called ESG, balloons. There's a whole list of things we can do based on what person needs.
No, okay. I know someone had just asked me about any, as far as the different procedures for bariatric surgery. I remember in the beginning we used to do nothing but the lap bands.
Well, no, lab band was actually not the beginning. It was in between.
In between. Okay, I don't go back that far, but the lap
The beginning it was gastric bypass, and
bypass.
then
Oh God.
later we added on gastric sleeve, which is we're not touching the intestine, we're just making the stomach smaller.
Right.
And then lab band came around. Right now, mostly we take lab bands out. We don't really put them in anymore. We're mostly in the process of taking them out and converting those patients to a sleeve or bypass. But yeah, lab band was a kind of like one of those newer inventions that like people were trying to come up with. How else can we help somebody without changing their anatomy too much?
Okay.
Um,
And any what I mean, what are the risks now associated with the surgery? How are we managing with that?
Doing great with all the experience and advance in technology. Risks are probably not more than taking out your gallbladder.
Okay. All right. So people are actually tolerating it a little bit better now.
They're tolerating
And
it great.
oh, great, great. I know in the beginning, I know it was just like, getting them selected. We weren't only able to do people that had a BMI of like 35. It's the only way we can get it covered.
So still right now with insurance coverage, they want BMI of 40 or above, or BMI 30, 35 and above with comorbidities, with meaning other medical conditions.
Okay.
Um, if you not going through insurance, those numbers don't really get followed the same way. We're actually looking to change all the BMI system because it's not accurate. It does not apply to everybody the same. So
Okay.
if you look at different ethnicities, somebody who is, let's say, from Asian, countries, who are naturally built very thin and small, for them BMI of 35 is like 50 for somebody who is from different background. So they
Right.
can actually start looking at surgical intervention at BMI 27 by current standards, because for them the health risks are way higher at that range. So the number itself is just a number. It doesn't really mean much. We cannot apply to everybody the same, but that's what insurances do, of course.
Oh, okay. And what about the hospital stay? Is everything ambulatory now, or you still have people that have to stay at the hospital for a few days?
So mostly it's done as outpatient surgery. Outpatient surgery centers, they go home the same day. We usually bring patients back the next day to give them some fluids, to check on them, to make sure they're doing well. I mean, there'll be a little bit of recovery, a little nausea, a little cramping, it's surgery.
Right.
But people go to the hospital only if insurance requires it. Some insurances only want to have patients be done in the hospital. And if somebody's BMI is really high, like over 60 or so, there are a couple parameters, female or male, it changes a little bit. But the extra high BMIs, because it's just safer to be done in a hospital, because those people may need to stay in the hospital longer because of the breathing issues or whatever else that can happen.
Yeah, most of the people that we saw in the beginning were all had comorbidities. It was rare that you saw someone with a BMI over 35 or 40 with no issues whatsoever. Or quote unquote, no issues. I guess that's the easiest way to say it. And how's the postpartum process? I mean, how often are you following people afterwards?
The post-surgical recovery process. In my practice, we have different setups. So we see people more often and for longer periods of time, because we look at obesity as a chronic disease. So we don't just do surgery and then do a couple of follow-ups and don't see them again. We prefer to see them more often, because I feel like that's why you have a relationship with the doctor. And if you're not losing as fast, or you're not losing too much, whatever the issue can come up, we can be on top of it and take care of the patient. And they're also not afraid to come back. I've seen a lot of it where patient had surgery somewhere, and then years later they come to me for different reasons. I'm like, why didn't you go back to your surgeon to discuss this issue that you're regaining weight back? I was so ashamed. I was so afraid. I was, like there's some kind of shame associated with it because of all the fat shaming that's going on in the country. So I much rather have the patient close to me and they know, if anything, you come right back, and we have to continue to care for you, give you medications, do something else, because it's a chronic disease.
Yes. So for a patient that's suffering from weight, they're complaining about the ability to control their weight. They have weight issues. How would they go about finding you all? What do they do? What's the first thing? What's their first step now?
Well, they can just call us.
Okay. All right. So.
They can call us, or they can go to my website, ibihealthcare.com.
Okay.
And it's IB as in boy, ibihealthcare.com. And we have a lot of information there, a lot of videos. It's like a little encyclopedia. They can read about different procedures, sign up for appointment. They can call my office and get pricing on procedures. It's very transparent. Because again, we specialize to bring the surgery to everybody. So if we can bring the pricing down, we do. And we set up consultation. We can do telemedicine consultations at first, because we do have a lot of people from out of state that coming in. And then once everything's set up, they go through the process, then they can fly in for surgery.
Right. And that 6 to 12 month period, what's going on during that time?
So again, you're talking about insurance patients. So yeah, for insurance patients, they need to do monthly visits. And during that time, they need to, the idea from insurance companies, they want people to try to lose weight.
Right.
What they don't realize, people don't call a surgeon to start with until they've tried everything for many years prior.
They've already done it.
But now I have to document it. So, we document, monthly visits. Some people will get started on medications like semaglutide, Wegovy, Ozempic, anything that can help them start losing weight and get their health kind of improved. Because even for surgery, we want patient to be in the best shape possible. They have to meet with nutritionists. Before surgery, insurance will require to see a lung doctor and heart doctor, a psychiatry doctor to evaluate them to make sure that they are right fit for surgery, they understand everything that's happening, and that they can handle the surgery.
Mm-hmm.
And then once we collect all that data, then we'll send it to insurance for approval. And I said that process is much shorter for somebody who's paying out of pocket. And in my practice, 90% of people that come to us are the ones who don't have insurance.
Well, that's nice.
Usually that process goes way, way quicker.
A lot faster. Wow. So, and a lot of people just don't want to wait the whole year. Of course, if they can afford to pay, they will pay out of pocket.
Yes.
What supplement diets are you all using now?
So I don't believe for any specific diet, if somebody just trying to lose weight, if I give somebody medication for weight loss, like Wegovy or semaglutide, then, we just go healthy, well-balanced food, intermittent fasting, something that's not extreme, something that can be maintained without going crazy.
Yeah.
Yeah,
I
if somebody
remember
has
this liquid
surgery,
stuff. This liquid stuff.
liquid stuff, yeah. So for
you
the
used to drink.
surgery,
Yeah.
for surgery, you do have to do a few weeks or a week prior to surgery of liquid diet to kind of make your liver smaller, shrink your liver, and get body ready for it. And then after surgery, of course, when we cut your stomach or do something to your stomach, you physically cannot put solid food in there in the beginning. So we're gonna have to do little protein shakes and liquids for a little while, and like a baby, slowly work your way up back to regular food over time.
How are you guys managing as far as your success rate and weight management and weight loss?
It's great. With appropriate management, I think most people succeed. And again, now with medications, we combine the treatments. So we combine surgical and medical management together. Now that's more available, and there are more medications coming out specifically approved for weight loss that are long-term medicines. So I can start somebody on Wegovy and keep them on that medicine for the rest of their life, like a diabetic person would be on medicine for the rest of their life. Because again, it's a chronic problem. So as long as we combine treatments and have all the tools that are available to us put together, patients do very well.
Wow. Now for the fun part. It always used to be the fun part for me. What are you doing with the skin?
So that's where I come in personally. Because I have 5 other bariatric surgeons, but me and actually 3 other plastic surgeons in my practice that will help patients with skin removal. So we do a lot of mommy daddy makeovers, removal of the skin from different parts of the body, all kind of breast lifts and reductions, tummy tucks, thigh lift is one of my specialties. So we kind of, it's individually tailored because everybody going to carry their weight differently. Some people shrink enough they don't need to have reduction surgery for for skin, but we take it to the next step basically once they come to me.
I know skin removal has always been an issue. How's the coverage for the skin removal now?
Not very good. Very good.
It's funny. I remember I had contacted and I had worked out an arrangement with a burn center in New York years ago, where they would actually do all the skin removal for us for the patients at no charge. This was years ago, of course.
Wow.
Because that's a huge surgery, and the burn centers, they always needed skin, I guess, until they got so much where they couldn't do it. They couldn't do it anymore. They had an excess of skin, after a period of time. But I remember that we used to do that for some people had just so much skin after the weight loss. And, a lot of people have a hard time affording it because it can be expensive. I know there were a few plastic guys that offered financing in their office and all kinds of, wonderful plans so that people didn't feel as though they would go bankrupt in the process. And I know that always used to be I would look and it's like, wow, when you start doing this, that's always the biggest complication is first, they don't like their morphology. Basically they don't like the way they look because they're overweight. And once they lose the weight and they look at themselves, they hate that even more.
They also don't like that because it's wrinkly and it hangs.
Yeah, it's hanging, wrinkly skin. Oh my goodness. And they hated it. And, people call me all the time and say, you know what? Are there any creams? I said, creams?
I said, the moment I invent the cream, I basically retire. If there was a cream I could invent that can shrink skin, some kind of magic.
No magic at all. Wow. Can you tell us about one of your patients that you found to be probably your best success story?
I have great patients. My favorite patients are the ones that work very hard to lose weight, I have several patients that they almost become like friends, friends of the practice. Like we know them, they come in, they can text me on social media anytime. Have one lady, she had like, it starts a lot of times very sad, a rough childhood, some traumatic events. They gain weight throughout her life because of the psychological, issues because of that event. And sometimes I have a couple of patients that were 400 pounds. One was 360 pounds. By the time, they got to the point where like, okay, I got to take things in my hands and like get myself healthy. And they work very hard, go through the surgery, go through all the appropriate, weight management, get down to happy weight. And then usually I do one part at a time. So it's kind of like a slow reveal because I don't do surgeries longer than 4 hours if I can help it, for health and safety reasons.
Right.
So slowly, let's say we do tummy first, then breast and arms, then we do the legs. And then I get all these pictures afterwards, I'm over here, I'm on the beach. So it just, and I mean, I have many, many examples like that. We have a lot of patients that go through the process and, they're happy to send me afterwards, them dressing up in this event. And here I am now. And just seeing the change and how active they become, how, they can go and play with their kids or grandkids and do different activities that before they couldn't do. It's just really, really rewarding. And I learn a lot from them. Like, for example, thighs. I mentioned I do thighs, but I do the surgery. It's great. It's hard to find somebody who does really good thighs on people who did lose so much weight. And next thing, like, I can cross my legs now. I was like, I never even thought. I didn't know. Like, I don't know about those things, right? As a person who didn't struggle with that. The only time I had a struggle when I was pregnant, but other than that, so little things that like regular people who didn't struggle with that would take for granted. Going up and down the steps, picking something up or tying your shoes. But the thing was like, I'm on the beach and I crossed my legs and she has leg over the leg. And I was like, I didn't,
Life's going on, right? It's amazing that you say that. I remember we had a company came in to talk to us about, talk a couple of patients about what we were doing. And I had put a studio in my office so that, and I hired exercise instructors, nutritionists, the whole thing. So people were coming every day and exercising, because the goal was to get them to surgery, to do just exactly what your group does. And I remember one lady, she just started crying when they were interviewing her. She said when she first came in, I mean, she weighed well over 500 pounds, this lady that came in. And when she came in, she said, they used to roll her in pretty much in, this huge wheelchair, one of those bariatric wheelchairs. And, she would, she could barely move in the beginning, but she would exercise while she was in the chair. I remember that, to the point where after a period of time, she started walking in with a walker and, and I remember when she said to the reporter, is that when she first came, she couldn't even bathe herself. When she went to the bathroom, she couldn't clean herself. And she says, all those things are behind her now. And, she doesn't know when she'll be able to get the surgery, but her life has changed drastically just based on the little things. She couldn't even stand up at the kitchen. Given her size, she said she couldn't even stand up at the stove to cook and make meals anymore. She had gotten so big. And I'm just looking and I was like, wow, I didn't realize, through the process that the way you really change a person's quality of life, just basically with weight loss surgery or just managing them to help them begin to lose the weight on their own. And, it was really, it just made you feel good when you actually see, because, in medicine, a lot of times it's hard to gauge what you do, because people generally, they don't get better. You put them on medication and you're basically trying to maintain them and pray that they change their lifestyle so that they can, live long, healthy, good quality lives.
Absolutely.
But when you got people like this here and you actually see, wow, unbelievable, and I mean, I have some, like you say, they come to your office forever. They become friends. They're like family. I remember I put a lady in the hospital because I mean her weight was just so dangerously high. So I actually put her in the hospital to restrict her diet, so to speak. I'm gonna help you lose weight. I remember this. This is the
Can't do it anymore.
Not anymore. I know.
Cannot do that anymore.
And I'm working with her. And I have her in one of those wonderful hospital beds that monitor her weight for me. And I'm sitting there. I mean, this lady's not losing weight. She's actually gaining weight. I'm like, what is going on? So one day, I said, you know what? I'm going to sneak up there. She knows when I come. So I went at a different time. And she was pretending she was asleep. And when I moved the sheets, she had pretty much a grocery store in the bed with her. And we talk about how much of a medical issue it is, and people don't realize the psychological component that goes into just trying to lose weight or get healthy. And people, what you're having to deal with, the depression, the obsessive disorders that a lot of them have, the eating disorder that a lot of these people have, and how much they're really suffering. And a lot of times they can't help it. They really can't help it. And I'm sitting there and I look at her and I looked at her children, and they were all following the same path. I mean, she was, a beautiful, wonderful, happy lady. But the thing was, it's like, I got you here to help you. Why are you have a case of honey buns next to you in bed? Oh, I lost you.
I'm right here.
Okay. You have a case of honey buns in the bed with you, and she's like, I can't help it. I can't help myself. I feel like I always have to eat, and, it was a real challenge with her, just trying to just get that, to stop that. The sad part about that story is that, as much as I worked with her for years, and, I've had numerous people working with her for years. We actually lost her. We lost her. She passed away. And, they're trying to convince her children, who actually went through the process with her, it still didn't quite register with them either. And it was like, wow, it is a real, the metabolic syndrome, which encompasses all of this, and I used to tell them, I used to show a picture when I used to teach the classes to the students, and I would send a picture, and I would say, I want you to look at this picture, and I want you to describe this person in one word. Give me a medical diagnosis when you look at this person, what does this person tell you? And, they would just sit there and look, and, everything was related to just their size. I said, no, I need an illness that encompasses their whole being, and it took a while for them to get to where I needed them to be, to see that this whole process is not just their weight.
No, weight is the symptom. It's a symptom of the disease.
It's a symptom of the disease. And, I said, everything you see here is from their breathing issues, which most of them suffer from sleep apnea. Most of them suffer from heart issues, diabetes, high blood pressure, cholesterol. Vascular abnormalities. We're talking about issues from top to bottom, but it's all centered around their body size, and, it's amazing. You should never have an issue. And that used to bother me that I had to wait 6 months to 12 months to get a person like this to the operating room, because the clock is ticking. The sense of urgency is right in front of you, but they don't want to pay. I know you're doing the paperwork. How many times do you often have to resubmit for approval?
Right. That's one of the things I never could understand. I was like, gallbladder disease, I can manage with antibiotics and diet changes. I can walk into the ER when I used to take call. I'll do 7 gallbladders in a day. Nobody asked me twice. But I was like, well, can I do the same thing with sleeves? Can we do emergency sleeves? Same way in emergency room, because half of those people need that. because that it's like ticking time bomb. Like you said, your friend that passed, unfortunately, the patient, I'm sure was related to one of the metabolic syndrome effects. So, I mean, why is the gallbladder bad? Well, because of obesity in the first place. Why do we have diabetes? Because of obesity. Why are we cutting off somebody's finger or toe? Because of the, vascular issues. Very likely obesity also. So why we're not treating the underlying issue? Why we're trying to, I call it the 6 months torture for the patients.
I said,
and
when you have to have surgery for some type of amputation as a result of your medical issues, that is like you're really spiraling in the wrong direction. From there we're playing catch up for real. I mean, it's just like you were coasting for a while and then you just turn and they don't even realize it, and I've actually seen people leave the hospital and go get cigarettes, go right to get some McDonald's or Wendy's cheeseburger. I'm like, this is not it, come on, but I don't, psychiatric services and psychological services are also uncovered, which is, I'm like, wow, I don't know about your practice, but when I hire a nutritionist, okay, and think about what you're doing, all right, I hire a nutritionist for my office that comes out of the expenses of the office. Why? It's not covered by insurance. I have to hire a psychologist that's not covered, okay? All these things come out of the expenses of the office. These people have so many issues, all right? And a lot of the services that you have to provide to get it authorized, the surgery, are uncovered. I mean, it's like fighting an uphill battle, and it's unbelievable. So I believe me, I get it. What a challenge. And, I'm like, what will it take for the world to realize that this is not, I understand the issue of choices, but the thing is that this is a real medical emergency. It's a real medical problem. It's not, they want to put Band-Aids on parts of the problems, diabetes. They want to put Band-Aids on high blood pressure. Say, well, what if we could do something to make all this go away?
Surgery. We do it for heart disease. We do it for heart attack. I always talk about that because a lot of people ask, medicine, surgery. I was like, it's both. Sometimes we can do one or the other, but it's okay to do both. If somebody has a blockage in the heart and they're like, it's an emergency. If you're not going to have open heart surgery today, you're basically going to die. Okay, doctor. Yes, doctor. Insurance. Yes, doctor. Emergency surgery. Best treat in the hospital at best wards because you got the surgical floor, the nursing, the ICU, cardiac. And then they go home for life on medicine, right? They're going to be on blood thinner for medicine. They're going to be on something for life, blood pressure, heart beta blocker, something. Well, I'm like, this is the same thing.
Exactly.
Why can't we have bypass surgery or gastric sleeve or duodenal switch or whatever surgery we do, and then you offer them GLP-1 medicines for life? And so that way we can maintain the weight loss because it's such a long-term disease. No matter what people do, they're going to try to get back up there. But I don't think, we cannot reason with insurance companies because they're not in business of making people better necessarily.
Okay.
In my opinion.
I'm thinking the same thing you're saying.
So we get it.
I mean, I think pretty much every doctor in the country thinks that.
They're just not in that business. And it's,
that's why we said let's do self-pay.
It's the same that we have to say things like that. But just like you've done, you found an area that you can work where people are saying, you know what, we're willing to help ourselves. And the fact that you're there for them, that just, that speaks, wonderful things because, I've seen it work for people and you have as well. So, I want to just encourage more people that, coming out to see you. I can't remember the last statistics. At least a third of the world is obese now,
it's getting worse in the world as well. America is the leader in the problem.
We're all the leader.
And 60% overweight and obese, and up to 40% in some states. In Georgia alone, I think with 39% obesity rate, not overweight, but specifically disease of obesity. and
South-
Alabama, Mississippi,
Southeast
like
is the
right
worst.
around the same way.
Yeah, the Southeast, I think, is leading the way for, I mean, I don't know. I mean, I remember when people ate at home. I mean, I'm from South. I spent a lot of times in the South. And I remember when you would drive down the road and the only thing you would find is gas stations. That's it. Now, everywhere you go, there's nothing but fast food everywhere, on every corner, every stop, everywhere. It's like, it's all over the place. I remember there was a time when none of that existed, and I remember that. I remember, we would go out, we'd get hungry and say, well, we're going back home and, grandma will make her something to eat. Now grandma doesn't make anything to eat. Now they go back and they come back with bags and bags of food, and I'm saying, I mean, I'm like, what happened? And typically, and I find it to be worse in the South. I was just like, wow, what happened here? Every time I come down there, I'm just, I'm like, wow, nobody cooks at home anymore, and I mean, I hate eating anything that comes across. I don't like fast food at all, it's just stay away from it. But that's all I've seen now. Everywhere in Atlanta, there's restaurants everywhere, food everywhere, and I'm like, okay, what are you eating? We're going out. What are you eating? We're going out. Everybody goes out. Nobody eats at home anymore. People buy nice homes with, everybody wants a fancy, beautiful kitchen, but nobody uses it.
Well, it's not just about fast food. It's also the processed foods, right? When pandemic started for obesity with late 70s, early 80s, when it's really started to take off. And it's a lot of processed foods, a lot of additives to the food that we don't see in Europe, for example.
Mm-hmm.
So yes, fast food was there, before that, but obviously the portion control was different. Portions were smaller, right? But then also we started doing additives, anything to kind of fast track and oversize everything and overgrow everything. And I think that has a huge part, because you can eat healthy and cook for yourself. And if you have the underlying condition, you can still gain weight.
Mm-hmm. Yeah.
So, and once you reach certain weight, it's pretty much impossible to lose, even if you starve yourself. And we know a lot of studies that did diet and exercise studies where only 1% succeeded, 99% failed under doctor supervision. So we know losing weight on your own with diet exercise pretty much doesn't work. We still tell people to do that, but we're like, yeah, just be healthy. That's my walk, go for a walk, eat healthy, don't eat junk, as natural as possible, stay out of the boxes, things that come out of the box, don't eat it. But it's with medications, I almost have to work with patients to teach them how to eat more, because I have a lot of patients who are morbidly obese who basically starve themselves because of that nature of like, you just eat too much, At this point, they're pretty much not eating anything. They eat so little, their metabolism is non-existent, and no matter what you try to do, it makes it worse.
Makes it worse, absolutely. They don't realize that you eat more frequently, less portions, and you just walk. Walking is the best exercise in the world. You don't have to.
Walking is good.
And it's free. You don't have to join a gym, country club. Just go for a walk. Even if I would tell people, say, you know what, you don't like if it's cold, walk in place, turn music on, dance. Everybody likes music. Most people either like some form of music. Just dance. You don't have to even dance well. Just dance by yourself. Just dance. 10, 15 minutes a day is all it takes. A little bit at a time. Just dance, walk. These simple things that don't require spending additional monies on gyms and fitness centers, gimmicks, these things you see on TV or the internet. Drink this, it'll melt your body fat. I'm like, really?
Yeah. The only thing I recommend is the magic medication, the semaglutide and GLP-1 medication. Once you have that, then you combine up with a little walking, a little resistant exercises, maybe just to maintain your muscle. And it makes the process all of a sudden easier. It really helps people. So I'm very, very big supporter of all those, GLP-1 medications, because I can now have something to give patient that works, that's not going to fail their heart, like Fenterman.
Awesome.
So.
Listen, because I know we're running out of time. Just take a minute and give people that that are listening today, and those that may come on later on, information to reach you. Tell us who you are, your office information, so people can reach out to you.
Yes, I have a couple websites. So first one I mentioned earlier, ibihealthcare.com. That's for my bariatric surgery practice. And then surgicarearts.com. That's for me and cosmetic surgery. And same names on Instagram and TikTok and YouTube.
It's okay.
We tried to put all the information. So IBI Healthcare on YouTube. And we put a lot of videos, a lot of information there. And then the phone number is 678-466-6760 for anybody who'd like to call in.
Awesome. Well, once again, everybody, this is Dr. Angelina. She's taken a lot of time with us today to talk to us about bariatric surgery or, weight management, weight loss, and also the importance as to why it needs to, people need to start thinking about it to just change their life. This is a different alternative, but actually part of the same treatment process, for basically lifestyle modification, weight management, leading healthy lives. For some people that find that they hit a brick wall that they just can't seem to get to the next step because they're just, they're just unhappy with the way they look, or they're just way too much, Now you have someone that you can actually call that can actually get you over that hurdle, okay, and help you. And for those that are concerned about the skin, there she is. She can help you with that too. So many people call about skin. It's unbelievable. But now we actually have someone that's part of the team, okay, that can help you with that cosmetic issue, later on, so that you can feel better about yourself. Dr. Angelina, I've seen people make unbelievable transformations, where they're like, wow, look at you now, So, but either way, once again, this has been another episode with Chopping It Up with the Doc. I really enjoyed spending time with you today, Dr. Angelina.
Thank you so much.
And, hopefully we'll all get a chance to talk again. And for now, everyone have a blessed day, blessed week. And, once again, take care of yourselves out there. Dr. Angelina, thank you so much. Bye-bye.
Bye-bye.